Yes.
Okay. This meeting to order. Attendance, please.
Ann. Here. Artist. Here. Dawn.
Here.
Grant.
Here.
Jim.
Here.
Mike.
Here.
Rod.
Present. Right, I'm standing. I pledge allegiance to the flag, United States of America, and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. Do we have any citizen comment this afternoon? I see none in the audience. Okay, we'll move forward. Approval of the agenda, may I have a motion, please? So.
I'll second that.
Motion's been made and seconded to approve this afternoon's agenda, all in favor?
Aye.
Agenda is approved. Approval of the minutes from March 20th, 2025. So.
I'll second that.
Motion's been made and seconded to approve the minutes. All in favor, signify by saying aye.
Aye.
Minutes are approved. Environmental Health Subcommittee report. Artist, you wanna?
Yeah. So on Monday, our group got together and we talked about the denial letter regarding depth to groundwater and so forth. And our recommendation to you guys would be uphold the health officer's letter so that the individuals then can bring the variance to us next month.
Okay, anyone have any questions concerning them? Seeing none, I guess entertain a motion.
I make a motion. Is that what we have to do?
Pardon me?
What do we have to do? Have to move and to vote on this now?
I believe so. We're voting to uphold the search.
So that's, it then can come up for a variance later.
And that'll be next. Perfect.
Excellent.
So may I have that motion?
I make a motion to uphold the appeal to the Flathead County Board of Health regarding the septic denial of the 265 Haskin Cross Road in Whitefish.
And I have a second. All in favor, signify by saying aye.
Aye.
Right, thank you, and that'll be moving to a variance, I believe, probably.
They would have to
next
submit
meeting.
it, but yes,
That has
that,
to do with the eco-john installations.
Okay.
All right. So we have a piece of appeal. Is this this is the one we just talked about?
yes,
Motion.
yeah,
One at 265 Haskell Crossing, so we had a vote on that. We upheld the director's decision. Moving on to departmental reports. We'll start with community health.
Good afternoon, I'm Rose Hash with Community Health. That happened quickly. Got to me on the agenda quickly. Nothing particularly remarkable to report for this month. I did want to highlight in our Parents as Teachers Early Childhood Home Visiting Program, we historically have had a wait list in that program. We've worked through that wait list, so we're doing some extra work to do some outreach and get more families enrolled in that program. In our asthma home visiting program last month, we had our asthma nurse Jill share more about that program. We got a really nice article in the Beacon out of that sharing, and she got several new referrals from that, so that was a really great opportunity for her. So that program is doing well. Are there any questions or concerns from me?
Questions from the board? Being none, thank you.
and Commissioner Holmquist texted and she'll be a little late.
Moving on. Population health.
Good afternoon. I also don't have too much to report out today. First off, we had some sad news. Our communicable disease nurse, Jonathan Griffin, will be moving on to new adventures, and his last day is actually tomorrow. April 18th. But we do wish him the very best as he moves on and wish him very much a lot of well good, and we're excited to see him go. The other just quick update that I have is we are preparing for just increased activity within our rabies control program, as the weather is getting a little bit better with the exception of yesterday and today. And the daylight is getting a little bit longer. We're starting to see an increase in our dog bites, cat bites. It's just because people are out there, out and about with their animals a little bit more with the nice weather. So, and then with that, we are also starting to receive some more calls about bats. So with all that, we're just gearing up for another busy seasons related to our rabies control program. So preparing for that. And Jonathan Griffin also did a lot of work within that program. So with his departure, we've been fortunate enough to work with Rose, who is letting us borrow Ken Wellington, who's willing to help us out with the rabies control program and some other community activities while we're working to rehire that position. So that was pretty much the only updates that I have, unless there's any questions.
Have you seen an uptake in, folks coming in with flu symptoms at all? I know we have up in College Fall.
Oh, I know our influenza, just our surveillance rates have been declining a little bit, but that's a good question. I mean, don't see people coming into the health department for influenza-like illness, but I haven't really heard anything unusual from the hospital, but check in with that.
Okay, thank you. Any further questions? Seeing none, thank you. Behavioral?
Good afternoon, James Pike, Behavioral Health Supervisor. Two things really to talk about here. We continue to see increased utilization of the mobile crisis team services. And the indications we have is that summer is generally busier for this type of work. And so we're preparing to kind of ramp up for that. We are exploring options right now for additional care coordinator positions to help support the mobile teams and really the care plans for individuals after they have had a mobile crisis intervention. And that's really the need that we're looking to fill right now. But we do have some good ideas for that. And then the other thing that happened last month is we were able to work with the county jail, Jenny Root over at the county jail, and develop a contract so that when we have clients that do go to jail are not diverted, that we can go into the jail and continue care coordination activities and really work to make a plan for when that person is out of jail, that they have somewhere to go, that they're connected to resources, et cetera. And that seems like a big gap. Before where we were working with people and they'd have some criminal charge and end up in jail, and we wouldn't really interact again with them until they were out. And so this has really been a meaningful step. And even the end of last month, our care coordinators were able to assist the jail staff in getting an inmate on their necessary meds, which really helps stabilize that individual and now actually has a referral to a facility directly from jail that we're working with the staff to facilitate. And so kind of an early win for that. And I'll just reflect that at the bottom line of this is unique incarcerated clients. We see them several times a week, but or every month, I'm sorry. But I'll reflect that here just so we can show what we're doing in there, but we're really excited about that program and that partnership.
All right, anyone have any questions this time? I just have a comment. That's a great job working with the jail. I guess that's a great step like that.
We are hoping more community organizations come to the table for that. I think there's a lot of room for jail-based services, even outside of mental health, but certainly in that space, they can use a lot of help there. So we're happy to do a little bit of it.
All right, thank you so much.
Thanks.
Next is family planning.
Good afternoon. So the end of March marked the end of family planning's fiscal year. And we were about 12% short of our unduplicated visit goal. We did have a provider retire in November, so we had about 2 months without a provider, so that might have accounted for the shortage of unduplicated patients. But March, we had a fantastic month. We were really busy. It was the best month out of the whole year. You might have noticed that we had an increase in Narcan distribution in March as well. The OENDP grant that we oversee for Region 6, which encompasses 7 counties, started in March. Most of these regions rely on the state ordering Narcan for them and distributing out. That has been shut down. So we've been filling the gap with some of our supply to get it out to our region. But the state assured us it would be open for ordering at the end of the month, so we'll continue to monitor that. Lastly, I want to share some exciting news. Our family planning clinic has officially launched vasectomy services. So we recently did our first vasectomy procedure a few weeks ago, and since advertising, we have 9 scheduled in the coming months. So we're going to be offering the lowest cost vasectomy in the valley, and it's also going to be on the sliding fee scale. So if you qualify for the sliding fee scale, you'll either pay from $600 to $0. So trying to fill a gap for males seeking that service in our community. Any questions?
Seeing none, thank you.
Thank you.
I don't see Brock here, but, Bob, Mr. Mosquito filled in.
Good afternoon, I'm Jim Wardensky with Environmental Health, and Brock supplied me with some information to share with you guys, so. One of the things that will likely happen throughout the mosquito season is, excuse me, Brock said that he'll provide the information and I can present it, and if you guys have any questions, just to keep those guys out there working and hopefully killing mosquitoes, so. As you can see there, between those dates that are mentioned, March 21st through April 16th, 430 inspections, 83 treatments, acres treated, 176, 5 new sites added, total sites are 1,645. So Brock told me earlier in the week that there's an area south of town that normally takes 2 to 3 days to treat. And with the advent of the new mister on the side-by-side that they utilize, he had it done in 2 hours. So again, the calculation that Brock had made about the time savings and all that, and he said it was really neat because as he drove along, he could see where the mist was hitting the water and the coverage and stuff, so, you know, it seems to be working out really well and well worth the investment, so. Any questions I can answer about mosquito stuff?
Seeing none, yeah, as long as you're there.
Yeah. Yeah, so from an environmental health standpoint, you know, we're starting into our busiest part of the year, both on the land and food side of things. A couple of things that I'll share beyond the numbers on the report. DPHHS is working on incorporating new software, a database that they'll utilize for tracking licensing and all of that stuff. They said that they think they'll have it up and running by July, and we're very interested in that for a couple of reasons. Right now, we utilize some software called Paragon, and we pay about $1,000 a month to utilize it. It works well. You know, the company works with us as far as changes, if you want to make any changes or any of that. The state database would be free to us. So, you know, we would potentially be saving about $12,000 a year. The other, and the state database offers some things that Paragon does not. The other thing that would be nice is, schools, campgrounds and tattoo parlors right now are in a different database for us. They're in the old database that we utilize called Access. It would cost extra if we added them to Paragon, so I think that's why they never did it. If we did move to this new database with the state, all of our stuff would be in one database instead of, you know, when I generate these reports for you guys, I have to pull some from here, some from there, some from here. So it would all be in one place. So I think what we're gonna do is, once the state gets us up and running, the schools, the campgrounds and the tattoo parlors, we're gonna put those into that state database and utilize that database with those criteria to see how well it goes. And if there are any glitches with it, before we jump on board fully, and walk away from something that's been working well for the last 15 years, so. We're optimistic about that. Months back, I think I mentioned to you about the idea of emailing the licenses out, to the retail food establishments, public accommodations places and all that. We've done that and are still doing that. And we've had so much success with it that the state, DPHHS, has said, hey, would you present to us at our next monthly call how you're doing it, the hurdles that you've encountered, the successes that you've encountered, because we at the state want to do it too. And when I talked with Stacy Evangeline there at DPHHS, she said it would be a cost savings of about $50,000 for the state. So it was a little bit of a proud moment for us because nobody else in the state is doing it. So, you know, Flathead City County Health Department is on the cutting edge once again, so. And then, I don't know if the health officer was gonna talk about legislative updates, no?
Yeah, you can.
Okay, so two things that environmental health was kind of tracking and, you know, one of them had, involved some of the septic stuff. It looks like that one is tabled and probably won't come back. It was, the primary focus of that was, that the counties couldn't be more stringent than the state. So then essentially we would just adopt what the state has. Again, there was some opposition to that, so it looks like it's not going forward. The other one that we're monitoring closely, is it talks about fee increases for restaurants, bars, public accommodations, all of that stuff, mobile food trucks, vacation rentals. And that one took a nosedive at the beginning of the week. They resurrected it and now it's, I think gonna get voted on. I haven't looked at it yet today, but that's a big deal for us. Essentially it would increase the revenue of those licenses by double. So as an example, right now, vacation rental pays a $40 license fee per year. And the slated increase would be, the license would cost $100. And you know, some of the other ones jumped up too. So fingers crossed, we're hoping that that goes through and we see those fee increases. I think they said the last time that the fees were raised on those licenses was 2007 or 2009, somewhere in there, so it's been quite a while, so. The last thing that I'll mention is, as you know, Fred Wolkers with our office has left. He moved to Great Falls to take a job with the Department of Livestock. And I've had 4 applicants so far. 2 of them were absolutely not qualified. One, I looked at the transcripts and it doesn't look like she's gonna be qualified either. Just before I came over here, I talked with a gentleman that's finishing up his master's in public health and lives in North Carolina. And we chit chatted about things. He's gonna send his transcript. I urged him to take a look at the cost of housing. He did. He said, I think I can make it work. So I'm cautiously optimistic about that, and I guess we'll see. The next step is we're gonna reach out to the state, because they have a network where they can, put the vacancy out there and see, what interest we get on that, so. Of course, then it will be a matter of training and all that stuff, so, we'll have to work fast and furious, to get that person up to speed, so. I don't have anything else unless you have questions.
Ron?
Yeah, can you speak real quick to, the monthly food and consumer plan reviews? It was the Blue Star Resort, and it says, they were all denied, and were they denied entry, or was it denied, or is it on hold?
So usually what happens with in the plan review stuff is, we have to look at both sides of it, right? The public accommodation stuff and the septic stuff. So it could be that, there's something in the certificate of subdivision approval, that's holding it up. I don't know specifically about what the details are, why, but it could be that their COSA doesn't allow it. It could be that they need to upgrade their septic system to do that. It could be that, the facilities that they have, as an example, if they wanna rent out, if they have a couple of different dwellings there, and, the accommodations that they have in there, don't allow for extra living units. It could be a planning and zoning thing too, so, there are a lot of things that are at play. And usually what happens with those is, we give the guidance of, hey, here's what you need to do to move this thing forward. And then the sanitarians will hang on to the file until, either they get it resolved or they decide, no, we're not gonna do it. But usually there's some sort of pathway forward, maybe an expensive pathway forward, but usually there's a pathway forward, so.
Yeah, it looked like there were
Yeah.
7 denials on that. So it's an outlier.
Yeah, so.
Okay.
Yeah.
Thank you.
Yes, sir.
I was wondering with these, school inspections, there's 2 of the elementary schools had a fair number of violations noted there. What were they exactly, the nature of those violations?
Yeah, so I think that they were administrative things. Although, this is kind of the 3rd year, that inspection changed about 3 years ago, maybe almost 4 years ago now. And, what happens is when the sanitarians go out, usually they meet with the custodian or maintenance staff and they walk them through the facility and all that. And it wasn't until like the 2nd year of this change that we realized that there are a lot of paperwork things, documentation that need to be provided to satisfy some of those criteria in the inspection. And oftentimes that's kept in an office somewhere in an administrative setting, and the custodian or maintenance person doesn't have access to it. So after that 2nd time that we went through that, we said, okay, here's the deal. Next year, create a binder, have all those documents in there, so that way we can review them and you don't have to try and scramble and get a hold of whoever it is that has the documents. Well, some of them still aren't doing that. So subsequently, they're getting marked off for not having the documents available.
So it's not something that's necessarily dangerous for the
No.
kids at all?
No,
And just to comment, I see that you had really good results on all your restaurant inspections. This time around, you guys are doing a great job of keeping those people informed. So.
well, thank you, and I'll pass it on, and they take a lot of pride in that, and again, it's really a partnership, although it's a regulatory interaction, we really try and bring people into compliance, educate them, and in certain circumstances where we've had facilities that historically have done poorly, sometimes it's just the change in management or leadership. And when we see that, we try and, give them kudos for that as well, to encourage them to continue those safe practices, so. Anything else? Thank you.
Health officers, excuse me.
Finance.
Good afternoon, Kurt Zander, accountant for the health department. This is the finance report for March. We're running about a couple $100,000 ahead of where we were last year, so doing well in that respect. Also attached, on the Board of Health, documents that you received was the, fiscal year 26 preliminary budget. And so, we met with the finance administration team and the county administrator on the 7th of April. They went through our numbers and so on, and they had no comments on that. We also had the finance subcommittee meet April 8th, and we sat down and had a good discussion on the budget and some of the items in the budget. And I'll run through some of these, but just the overall budget of the health department is 9.7 million. That's the whole operations, animal shelter, the health fund, mosquito, all the grants and so on. But the health department general fund's about 4 million, and health department grants are about 4.3 million. Just to give you a few numbers. For comparison, a lot of the grants are still in the early stages of determining final funding. So there's been changes as time goes on. Last year we had some, this year we had a couple that have had minor changes, and state has notified us. We've got into the budget a 1% COLA. So that's built into the budget, the personnel expenses. We held the operating expenses steady, so no change overall. That was at the request of the commissioners and the county administrator. We've held that steady. We've only had an increase in IT support and just what we need to contribute to the capital improvement project fund. The animal shelter, we keep an eye on the donations account because it's based on donations, and so far it's been pretty healthy. Austin did a great job of acquiring some dollars related to a mineral interest, which we've talked about before, which really boosted that fund. So not really too concerned about it right now. The health department revenue side of things, we're holding steady, I think, with immunizations, environmental health revenues, sort of projecting those steady, but there's a couple things that are in the horizon for mill levy revenue concerning property taxes. We don't know what the extent of that's going to be. And as Jim mentioned a little earlier, I'm hoping in the heart of parts that his increase is gonna offset any property decrease. So, and which would give us somewhat of a static situation. We aren't gonna receive any revenue from Greater Valley. I haven't built anything into the budget for lease revenue, which will affect us a little bit, but I've made accommodations for that in the budget. But we've been lucky this year. I budgeted 6 months for this particular year, and so far we've received payments, and they expect maybe to be out in August sometime, somewhere in there. So we might even get an extra payment for next year, so. But mill levy wise, we're expecting to mill the full amount, 4.63 estimated mills, so we'll be utilizing all of that. Due to that decrease in lease revenue, and like I say, hopefully we'll get some good news on the property tax situation, and that won't be as bad as we think. So we will meet with the Flathead County Commissioners on May 6th. To review the overall budget again. So that's really all I have. Do you have any questions on the budget or any finance documents?
Seeing none, thank you.
No.
Yeah, I'm gonna go to the health officers.
Well, I'll kind of do health officer. I don't have too much with my stuff, but I did want to give you an update on the animal shelter. So we do have 30, let's see, I get all my numbers right here. We have 34 dogs now. So one of the dogs that we had on that hoarding case of the Canyon area, had puppies this last weekend, and so we are now at 34 dogs that we cannot touch. So we can't, we can provide minor medical, we can vaccinate, but we cannot alter. The cost of care hearing, so there is a law that, is in place that's called cost of care. The cost of care hearing was supposed to happen last Thursday. The defendant's attorney had a family emergency, so then it got delayed until April 28th. So those dogs are still in our custody until April 28th. So still accumulating costs. So at that time for that Thursday hearing, it was gonna be about $30,000 of what it's cost, because it's about $24 to $30 per dog per day. For the care and welfare of the dogs. We also have 3 other dogs that are involved in a separate court cases for abuse that we cannot touch, or do anything with, or adopt out. So that puts us up to 37 dogs in our shelter, which we have a capacity, and it's a high, that's pushing it at about 50. So Austin has done a ton of due diligence. He did get, the first round, he did get 16 dogs out, but as we know, they fill back in. And so we were up to 50 dogs, and then he did get another 9 dogs out this last week, but again, we still have dogs being filled in, so, they are doing a tremendous job out there. The staff is, keeping these dogs, and they're starting to look really healthy and, look pretty good, but there are 37 dogs that we cannot do anything with, so, that's definitely adding onto the burden, because you can't do adoptions, you can't, alter, you can't do anything like that, so. Any questions on that?
What is that, for evidentiary reasons?
Correct, so the defendants would have to, relinquish the dogs to us, and at this time, they're not willing to do that. So that's where the cost of care comes in. The cost of care hearing is separate from the criminal hearing. So the cost of care is saying, okay, we have 34 of your dogs now, because we have puppies. We have 34 of your dogs now, you owe this amount of money. Either they work with the judge and start paying, or something happens, there's a deal that happens. That's truly to try to get animals surrendered, because, you know, they're not gonna let those dogs go back to the conditions that they were in. They were pretty horrific conditions. So it came out of, I think there was the Husky case, years ago, where I think Lincoln County ended up having 11 Huskies for almost 11 months that they couldn't adopt out. And so these hoarding cases have kind of pushed that to the forefront. So they've made laws to try to get them to relinquish them, to turn back over to us, so that we can at least get them adopted out and moving on. So, but you can only do a bare minimum of medical. You can provide for, you know, treat for parvo and get them rabies vaccinations if they have, you know, a cough, but we can't do any alterations of the animal. So you can't neuter them or spay them, which adds to the complexity of having them in the shelter, because you can't put them in kennels together. So these all have lived together, but if you were to put them, you know, to a female and a male or whatever in there, we would have more puppies. And, you know, we don't want any more puppies. So you have to keep them in individual kennels to keep them separated, so.
If they do decide to relinquish, does the county absorb the fees, or do we still go after them for that time that?
That would be up to the attorneys to decide from there, but they could, you know, part of the criminal hearing, you have to pay restitution, you know, it all just depends. I think the most important thing is that we would like to be able to adopt these animals out and get them out of the shelter environment, and we have a plan in place, so if we were to get those animals relinquished to us, Dr. Meg, one of our vet, and a few vet techs and some other vets would come in and alter them pretty quickly, within a couple of days, and then they would be available for adoption almost immediately. So we've planned for what we can do to get them out of there as quickly as possible, and I think there are probably our shelters, they're nice little dogs, and we have 7 cute little puppies that kind of are like puggish. You know, those go quickly, so hopefully we don't find any more pregnant. That was just one that was just showed up pregnant when we got her pregnant, so. And then the other 3 dogs, we were able to alter the other 3 dogs. They relinquished them, but we now have to hold them for evidence because of the trial thing. So those are a separate case, but that puts us at 37 dogs, separate from the other. So it's been a been interesting out there. So we're using one of the cat rooms for like the mom. So she has a bigger room to be able to move around with the puppies. So we cordoned off one of our cat rooms out there to accommodate her. So, and we can't foster them either because they're evidence. So there's a whole thing. We did, also with the shelter, we did, have bids go out for the vet. So Dr. Meg is retiring, at the end of this year. We didn't get any RFQs or anything for that, but we have been reached out to by some vets that are still interested. They just didn't get an RFQ in. So we are hopeful that there will be a vet, because that is our biggest, one of the biggest things that we absolutely need is a vet so that we can spay and neuter the animals before they go out. So I'm hopeful because I've had one vet actually come up to me at my daughter's softball game and like, I am interested in this. And so I talked to her quite a bit and put her in touch with Austin and Meg. So hopefully that will be the case. Friends of the shelter are working on trying to get turf on the other side. That would be a complete donation. They put turf on the one side and it looks great and it cleans up nice and the dogs are happy with it. So they have been doing some fundraising of their own and maybe looking at putting it together. It would obviously have to go to the commissioners first, but that is in the talk. So they really want to do that other side as well. So the general health department stuff, we've been in lots of budget meetings, negotiations and arbitrations. So I feel like that's all Keelan and I do is go, and Kirk is go from meeting to meeting to meeting. So that's taken up the majority of our time in the last month or so. Any questions?
I have kind of a question.
Okay.
So we've had different times offered and everything else for our committee, environmental health committee meeting. And what is it finally set as? This coming Monday?
No, I think it's the next week. Toby couldn't make the meeting on Monday, so we pushed it back
To the 28th,
28th. Toby couldn't come to that Monday, so.
from like 1:30 to,
I just got like 3 or 4 emails and I just, whoops, we can't do that one.
So we're having another environmental health subcommittee to go over DEQ to discuss changes. The subcommittee made some recommendations. The environmental health staff have been working on their own, going over, and we hope to just bring everybody together to have a discussion to see what we can do. We were waiting we had planned to do it earlier, but then there was a legislation in that would have made it null and void, and that's what Jim was talking about, that it got tabled. So then we're like, okay, now we're back up in business. So unless they do a zombie resurrection of it, we are back in business, working on those circular 4. So hopefully we'll have something to you guys, and then it'll have to go to public comment, and there'll be a process that we will do with all of that. Lots of
And
discussion.
then also we're gonna have to have that same subcommittee is gonna have to look at the variance application before the next meeting. It hasn't been brought forth yet, but.
Correct, and we would have it as a separate meeting. I didn't wanna do I didn't wanna put it all together. This is
So
separate.
we're gonna be busy again.
You are gonna be very busy.
Anybody have anything else, board member discussion that you would like to forward? Anything we brought up? Rob?
Just one thing, since you brought up the variance that'll be coming up, one thing I noticed going through that was with the 4-bedroom, the largest unit that they have doesn't satisfy it. So the solution would be to double up on units. So, and I understand that concept, but we've not ever had that addressed in our meetings before, that you could use 2 units to do more volume. And I don't wanna get into
Well,
we don't have to address it now, but it's, by the time we deal with that variance, that will be one of the issues, I think.
well, they'll have to bring forward what they're gonna.
Either they go
propose.
to a 3-bedroom or.
Is that right, Jim?
Well,
They'll bring
that's
forward
what
in their plan.
You've approved one that had 2 units out at
Did we?
Ashland Lake. Yep,
Okay, so,
yep, yes.
all right, that answers that. then.
There you go.
All right.
Any other discussion on the board? Seeing none, may I have a motion to adjourn.
I move to adjourn.
Second.
Motion's been made, seconded to adjourn, all in favor?
All right.
Meeting adjourned.
Let's do this first meeting. Told you it was going quick again.
The clock on the front of the county courthouse is 5 minutes.
Oh.